On my side of that. We agree there are big problems and there are people who are suffering because we haven't fixed it. But to pretend that what was on the table is not going to take away the insurance that people presently have that they want, even CBO agrees with that. It's going to drop it like a rock. So you can take CBO having half the information, or you can take the Lewin Group, which says 119 million people are going to lose the insurance that they have today that they want to keep. Both of those, we rely on them. They're fairly reputable. They don't have a pig in this football game. Why would we take a risk of that if, in fact, we really want people to have what they want? I'll close with a couple other things. What is behind the scenes in all of this that nobody will speak is mandatory physician participation in government programs. That's what's coming. It's thought about. The Kennedy staff talks about it a lot. Massachusetts mandates it. That's what's coming. We're going to say we're going to create a government program, and if we don't get enough people participating in it, we're going to pass a law that says you have to. Can we fix health care and still let true liberty and freedom survive? I think we can. It's hard work, freedom. It's hard work depending on what we know works in terms of setting forces at odds with each other to get the best quality at the best price. It's hard work. But it's coming. We're going to tell everybody what they have to do. And we haven't even begun to talk about what Senator Sanders would like, which would be all the physicians working for the government, because that's what they do in all the other countries. They work for the government. Our average federal cost today, as of yesterday, for a federal employee is $119,000 a year. Twice what the average cost is for everybody else that works in this country. That has great implications in terms of why the cost of government is so big. Finally, I would say this, and this is my last final, Mr. Chairman. If you want everybody covered with quality care, and you want everybody to have affordable care, and if you want to make sure we incentivize prevention so we control costs so that we can truly manage chronic disease, if you want to make sure nobody ever goes bankrupt, nobody ever loses their home over health care, if you want to eliminate the tragedies of Atricia Irvin, if you want all children covered and immunized and having well child visits, if you want the states to save at least $1 trillion over the next 10 years, and if you want to not spend the $1 trillion that's in this bill, and if you want to preserve the medical innovation that this country is known for, read the Patient's Choice Act. Just read it. You don't have to agree with it. Nobody on the other side of the house has done that. Haven't even looked at the ideas of innovation in terms of satisfying the trial lawyers but still lowering court costs, still lowering liability costs. We just transferred $250 billion a year in defensive medicine because we have an uncontrolled tort system in this country. And yet we don't offend the trial lawyers with this way of looking at it. Just read the bill. If you want to eliminate low birth babies, read our bill. It does. It takes every Medicaid patient out of Medicaid and gives them real insurance with real choice at the highest quality level, at the highest quality hospital every time. If you want to solve the healthcare quality problems, read our bill. At least look at it. Consider it. Don't just reject it out of hand. And if you want to do what's right in this country, for this country, let's slow this process down and let's make sure we got the input of all the innovative minds in this country, whether it be prevention that Senator Harkin and I are interested in, whether it be working on school lunch programs or food stamps so we don't pork everybody up because we're giving them junk. Read the bill. If you want a veteran to get real help, what was promised to them, health care, give them the choice to go wherever they want. If you want to honor your commitment to the tribes through the very treaties that we have, and you say we're going to give you health care, then give them a card and let them go wherever they want. And make Indian Health Service have to compete with them. Give them real freedom, but also meet the commitment that you've made to them. Today, we take Indian Health Service and we underfund it, we undercare, and then we have the pictures every year given by our colleagues from North Dakota and South Dakota about how bad it is. Yet we don't give them what we promised in the treaty we would, is access to affordable care. Let me tell you, access denied is care denied. Having to wait is care denied. We can live up to our commitments, and we can do all of it and not spend a penny more. And we can get everybody in this country covered. We can eliminate low birth weight babies. We can do the prevention we need. We can control chronic disease. But we can't if we won't listen and talk to each other and talk to the people outside of Washington who know what the heck's going on, like Dr. Cooper in Texas. Just look at what's happening in El Paso in the schools. They put an exercise program in there that has dropped BMIs, dropped dropout rates, raised education, decreased drug use, and increased graduation rates. Just through exercise, because the new neuroscience today says that you learn 20% more if you've been exercising before you go into class. But we ought to incorporate all that, all the incentives to help us do what we want to do. But we haven't taken the time to listen. We've said we got to be on this schedule. So my appeal to you is, I honor you for your desire. You have the same desires I do. How we get there is very different. And I would remind you of the 3 tenets of medicine. Listen. They'll tell us what's wrong. If it's been done, don't do it again. And for God's sakes, don't do any harm. Thank you, Mr. Chairman.
Thank you very, very much, Senator. I appreciate it. And Senator Merkley.